Regardless of where someone lives or where they go to see the doctor, the $1.6 billion cut to the National Institutes of Health threatens all of us. And that's what these cuts are going to do to medical research, cutting $1.6 billion from the National Institute of Health. I've always said I'll take this issue to any corner of America, any group, liberal or conservative, young or old, and make my case that an investment in health care research is one of the most important investments our government makes. And when we shortchange medical research, we shortchange our future. Great medical care is only as good as the science behind it. Drugs and devices work only as well as our understanding of the medical conditions they're treating. Our country is rich with promising research. We lead the world and should be proud of it. We have the bright minds, the curious scientists, the innovative labs. Today, countless people are engaged in work that will lead to better treatments for arthritis, Alzheimer's, AIDS, diabetes, cancer. The list goes on. Biomedical research supported by the NIH has established the United States as a leader in the world, and we are right on the verge of making life-changing discoveries through this research. But sequestration, which is now in place, will have a ripple effect that could curb medical discoveries and weaken the economies across the country. Dr. Francis Collins, director of the NIH, says there's no question that sequestration will slow the development of an influenza vaccine and cancer research. Eli Zerhouni, the head of the NIH under President George W. Bush, said, quote, "We're going to maim our innovation capabilities if you do these abrupt, deep cuts at NIH. It will impact science for generations to come," he said. Right now, when so much good research is moving us forward, we should be doubling down on medical education, innovation, and infrastructure. Cutting back on NIH and biomedical research is so short-sighted. Medical research saves lives, keeps America's place as a leader in science and medicine, and it generates economic growth. And, frankly, these cuts really shake the confidence of people in this field. Trying to decide whether they should dedicate their lives to medical research with the uncertainty of sequestration and budget cuts is unfair. For over a century, NIH-supported scientists have led the way for important breakthroughs to improve health and save lives through the discovery of things like the MRI, extending life expectancy for people with cystic fibrosis, revolutionizing our thinking about cancer, improving our understanding of stroke and heart disease, and creating new vaccines that save lives. President Obama has called congressional leaders to come together to create an alternative to sequestration. A balanced mix of smarter spending cuts and revenue from closing loopholes that benefit higher-income individuals will mean that we can keep our commitment to medical research. We're going to start the debate, Mr. President, this week on the continuing resolution. One of the early amendments is likely to be offered by Senator Harkin, who chairs the Labor, Health, and Human Services Subcommittee of Appropriations. I've spoken to Senator Harkin. He is determined to do everything he can to give the Senate the opportunity to continue to cut the deficit, but to do it in a way that will not make dramatic negative cuts in medical research. I hope we can get a bipartisan consensus for this. Diseases and the threats of ill health strike us all, regardless of party affiliation. We should come together in a bipartisan basis to support increasing medical research and maintaining America's lead in the world. Mr. President.